Welcome to Channel 17, the Town of Colonie Government Channel.
Hello and welcome to Focus on Health. I'm your host, Peggy Mello. Today's guest is Cary, Director of Senior Resources for the Town of Colonie. Welcome, Chris. How are you?
I'm fine. Thank you for having me today.
Why don't you start out by talking, maybe doing an overview of the services provided by Senior Resources.
Okay, thank you. Anybody who knows the Town of Colonie services knows that we're very rich in senior services. But they're very vast, and they can be a little bit confusing because they come in a variety of forms. So I'll start by talking a little bit about what the Town Senior Resources Department provides. Our department is primarily an information and assistance office. When folks are looking for information on services, whether it be nutrition or home-delivered services or housing, we consider ourselves the place to start for services. We have information sheets on almost anything that a senior could want. We even have a list of laundry services that will come and pick up your laundry, do it, and bring it back to your house. So we try to stay on top of what seniors request, what they might need. We also do a lot of work around benefits and entitlement programs. Some of those programs include heating assistance, and we'll talk a little bit about that later, but the Home Energy Assistance Program, health insurance counseling, nutrition programs including food stamps, help with paying for your Medicare premiums. That's a big program that we do a lot of work on, and getting health insurance and different programs for folks who don't have health insurance. So that program, in addition to the services that we provide to support caregivers, we focus a lot of our services on helping adult children who don't really know how to navigate the services and the service systems for their parents. So we do a great deal of work around caregiver support services. So the core programs would be the benefits work, the information referral, and caregiver supports. Our offices are located at 6 Winter Circle, which is the Beltrone Living Center, and we rent space in that building just like the tenants who live there. The building is owned and operated by Colonie Senior Service Centers, and this is where it gets kind of confusing for folks. It certainly does. And the Senior Center is exactly what it is. It's a center where there's health and recreation programs provided through the Senior Center. There's an adult day program, Bright Horizons. They run the transportation program, and they do a lot of wellness, congregate meals out in the community at different locations. So the Senior Center their focus is much more on the health and wellness programming. We work very closely. The town does fund the Senior Center to provide their services. And then the third arm of the senior services provided in the town are the 7 senior citizen clubs, and they are very independent senior clubs that are located in different geographic locations around the town. And seniors have their own bylaws, they have their own officers, and they get funding from the town, and they do a lot of wellness, recreational trips, activities, educational classes, and they're very unique and very have a neighborhood flavor to them. So we have a club in Manans, we have a few in Colonie. North Colonie is our newest site. We're going to be starting a club, an extension of one of our clubs on the north side of town. So that's kind of an overview of it. If you call any one of the numbers, which I'll give at the end of the show, we'll direct you to where you need to be.
Okay. Now, the definition of the word senior to me has always been confusing. Sometimes it's defined as, 62 and a half, or 50, AARP starts at 50, right?
Right.
What kind of age requirements do you have for people participating with your programs?
Well, again, I always tell folks, consider yourself a senior when you get a free cup of coffee with that word, because if you know, a lot of them go to McDonald's in the morning to get their free coffee. But for our department, our primary services, because they come through the Albany County Department for Aging, is 60. for a lot of the benefit programs that we do. We won't turn our back on anybody that calls. To join the clubs, any that I just spoke about, you have to be 55, so there's a difference in number. If you want to get on some benefit programs, maybe through Medicare, that's 65, so it does vary, but we do use the benchmark number of 60 for our services in the town. But we tell folks who maybe are a little younger or a little older, call us anyway. Let us help in any way we can.
Okay, so if I'm 40 and I need food stamps, I can't call you, right?
Well, yes, you can, because what we have once a month in our office, and I'm glad you brought that up because I don't know that I would have remembered to talk about it, is a Benefit Assistance Day on the second Friday of each month. And we find, because there are so many folks who don't know where to begin to get services or don't have the ability to go down to Albany County Department of Social Services on Washington Avenue because of parking and transportation,
Right.
we have those services come to our office on the second Friday of each month. Now, you need to make an appointment to see a caseworker for food stamps or for Medicaid or for heating or for Social Security, but those representatives come to us, and it's open to all town residents. So though our focus is on folks who are over 60, we don't turn away folks who need help with getting the basic essentials to be able to provide for their family, and food stamps is one of those programs. And we also do a lot around disabled folks because we know that they're going to be seniors, most of them sooner than later, because we help a lot of folks who are disabled in their 50s, and we feel if we can make linkages to Social Security or to veterans or to
Right.
Medicare, why not help them now before they need more help in the future?
Now, I heard you mention before about the 7 senior clubs in the town. Can you give a little bit more detail about those?
Sure. The 7 clubs, to me, in my job as the director, is probably the funnest part of what I do, because the clubs are very unique, and I've been out speaking this month at all 7 clubs, and I recognize when I'm out with each one that each club does different activities. They do different trips. Some of them have a meal program, some of them don't. But it's an opportunity for folks come together and socialize. And when I go out to speak to the clubs, they don't want me to talk too long because this is their opportunity, once a week or once a month whenever they meet to get together and to socialize with their friends. Each club is unique. Most clubs have a business meeting once a month, and then they have weekly activities. The Colonie Club has a golf tournament, has a golf league. Many of the clubs have, music appreciation. They may have art classes, a lot of exercise programs. And trips are a big component of this, and the town tries to give, or doesn't try, does give each club some funding each year to offset some of their program costs so that it can be more inclusive to more seniors, can afford to take the trips or to take the classes. So the clubs are all unique, and I urge anybody who wants to find out more about the clubs, we do have information on it, and you can call the club presidents and they'll go through and spend as much time with you explaining what days are, things are going on and what clubs. The important thing to know is you can belong to all 7 clubs or just one club.
That's what I was about to ask.
You can join all 7 clubs, go on the trips and the activities of all 7 clubs. There is no fee from the town, to join the clubs, but many of the individual clubs do charge a membership fee. Most of them, it's about $5 to, an annual fee from the club to be a member. So.
That sounds like a lot of fun.
Yeah, they have a good time. They have a great time. And, wellness and prevention and socialization is the key to living long and living well. So.
Well, I honestly think that is true, the socialization part, because if you are in any way stuck in your house and isolated, your health is not going to be the greatest.
Particularly your mental health. And that's so important. We see such a increase in depression and in the elderly, and a lot of that does focus or just stem from the isolation and the loneliness.
Absolutely. Now, the next question is, can you tell me about the town nurse services?
Mm-hmm. We're very fortunate to have a town nurse in the town of Colonie, and her services are for any town resident from birth to, old age. So if you were a young family that needed, a wellness check on a baby, or you needed some information on doctors or questions about medications, you can call her every day, and we'll put her number up at the end of the show. But she's available. Her name is Susan Kaiser. If you get her answering machine, because her work is out in the field, she goes out and visits folks in their homes. Some of the services that she can do, and she does a lot of this, is medication management, doing advocacy with doctors to make sure that, you know, the meds are working okay, or if the nurse goes out and thinks that somebody needs more home care services, she'll talk with the doctor's office. She refers a lot of the folks that she sees back to our office for maybe nutrition programs and different things like that. She can do, she can also do, she does blood pressure monitoring for folks, and that's a really, it seems like something that, well, we can get your blood pressure done anywhere, but it's so important for seniors to have a handle on what their blood pressure is and how it may change. It's really important to keep a handle on that.
Does anyone need health insurance, or do they have to pay for the services?
There's no charge for the town nurse services. You know, you pay taxes in the town, and these are the services that are there for you to use free of charge. Like I said, she's out of the office all day seeing folks, so if you get her machine, it means she's going to get back to you within the next day or so. Many people come into the office if they need, maybe she does like B12 injections and different types of injections. She doesn't give flu shots, but she can, under doctor's orders, you know, give injections and so forth. So a lot of folks do use her. Of course, the bulk of her caseload is seniors, and that's good because all of these services are services that will help keep people living in the community.
Okay, that sounds really great. I never even had heard of it.
Yeah.
Great. There's a very exciting event, October 22nd at the Crossings. Can you please explain what that's going to be?
Yes, I'm very pleased that we're going to be offering a housing fair for all town residents. It's not just for seniors. The information is geared towards seniors, but it's important that caregivers know and take advantage of this information as they help their parents, you know, make decisions about, you know, staying in their home, or what's, you know, what home care services are available, or what housing options are available. And the program is terrific in the respect that it will be a regular housing fair. People know us for our health fair, and it's going to be the same kind of model of program where there'll be representatives from all types of housing organizations, whether it be in-home services, we call it Lifeline, but they're personal emergency response units. They'll be there representing the services that they provide, housing subsidy programs that are available to help people with, you know, rental assistance and so forth. We will have representatives there to help people with weatherization programs for their home, you know, how different programs that can help folks reduce the cost of maintaining a home. And then we will also have representatives from financial programs, reverse mortgages, housing counseling, EMS, fire prevention, the town nurse, different services that will all help people to be able to stay in their home. Or also to find out maybe staying in your home isn't really the best option for you.
Yeah.
And that's another piece of it. You know, after the housing fair, part of it, as part of the day, we're also going to have a discussion panel. And the panel will represent financial folks, housing folks, and people in the health and human services arena to talk about the strategies that it takes to financially maintain in your home. Because as caseworkers for the town, and our goal has been for the 30 years that we've been in business to help folks stay in their own home and maintain in the community, it's getting in harder and harder for lower income seniors to financially, you know, maintain their homes. So that was the reason for doing the panel discussion. So folks can start to talk to their family members, talk to their spouses about, gee, you know, we used to be able to get up and clean the gutters ourselves. We used to be able to do all the lawn maintenance ourselves and the snow blowing. And as those costs increase, as you have to start to pay for them, and maybe your health care cost and everything else is going up, seniors are looking at their budgets and saying, wow, I don't have the money that I thought I was going to have to maintain in my home, and I know I'm going to need a new roof pretty soon. So the whole goal of the discussion is when people start to think about all these things that it really takes to be able to stay in your own home. And you know, there was a time when there was a good amount of public funds available to help folks with major home repairs if they were income eligible, whether they needed a heating system or they needed a major appliance or a roof. And you know, with the way the economy is now and the shrinking public dollars, there's not that financial assistance available that there once was.
Right.
And we're finding that to be a very big challenge as we try to help people stay in their homes.
Now, in case our viewers don't know about Umbrella of Colonie, can you just quickly mention what that is?
Yes, an umbrella will be at the housing fair, and it's a terrific new program. It's been in existence a little bit over a year, and it's a home maintenance program for folks who need the assistance like we talked about. They can't clean the gutters. They can't do the home maintenance that they once did. It is a program that's run by Colonie Senior Service Centers. It's housed out of 6 Winter Circle, and they employ handymen to go out, and most of them are retired handymen and women, to go out and do the home repairs. The first thing they do is come out to your home and do an inspection, a safety inspection, to make sure that you know your home is in good shape.
And that's a big deal.
That is a really big deal. You know, they'll look at different types of hazards that may be existing that you don't even see. They'll look at some of your electrical systems and so forth, many different other things. And then what they'll do is kind of, you know, these things we should address, these things, you know, may be okay to let go for a little bit of time, whatever they find, then they'll address it. The nice thing that's happened this year is the town has been able to help fund the umbrella program. There is a fee, a scholarship fee. There is a fee to join the program each year, but the town has made available some funding to provide scholarships for lower income seniors that wouldn't be able to pay the fee. In addition, the town has also made available funding to help with some of the home repairs. So that's a really big help. If you go out, if you have them come out and do the inspection and they say that, oh, you have some electrical work here or this door needs to be replaced, if you're income eligible, then the town can help with paying for some of those repairs.
Wow.
So that's a great program as well.
That is great. Okay, so the fair is going to be financial, it's going to be benefit related, it's going to be medical. There's all kinds of different things. that
Health
are
and
gonna be there.
wellness.
Right. So we didn't mention the time, so let's just...
Okay, it's from 1 to 4 on October 22nd at the Crossings, just down the road from the library, the Crossings Park. And there's as you go in, you know, we will have good signs out so you'll see where to go. But it's in the large room, the large meeting room that they have inside the Crossings building.
Now, one of the interesting things you were talking about earlier before the show started was statistics, numbers, census numbers in the town of Colonie. How many are over 85? How many are seniors? Can you just
Well, I can give you
mention
some
those again?
ballpark figures that the senior population in the town of Colonie is over 17,000. That's a pretty big number because the town's overall population is approximately around 80,000. I don't know the exact
I
number.
think it's 81 something.
81.
Yeah.
The senior population is approximately 17,000, but the interesting number inside of that is that the fastest growing segment, not only locally but you know statewide, of this in the senior population is the 85 and older. That's the fastest growing segment of the senior population. And we are finding, when I first started in this field, if I had a senior I was helping that was over 90, it was like, wow, she's over 90. But now everybody I help, it seems, is over 85 or, getting on in their years. And many people, years ago at 85 or 90, they weren't living in their home. They were going to nursing homes or adult homes. And now with, so many advances both in the medical and the health and wellness services and housing services, folks are able to maintain in their homes much longer. It's the most affordable place for the most part for a senior to live. So in the town we try to provide what we can to do as much prevention and as much maintenance early on so that, people can stay in their homes.
Now, I did help somebody in the library the other day that was over the age of 100. And he wanted a book to read. That was interesting. Your department is celebrating a milestone shortly.
Yes.
You want to talk about that?
Yeah, we are this year celebrating our 30th year. We've been around since 1979. Many of the viewers know Jan Medved, our director, who started this department 30 years ago, and really was a pioneer in the way services are delivered to seniors on a community-based level. We've always been at the forefront of delivery of services and been the model for other communities to, try to follow. So we're really proud of this accomplishment, and at the housing fair, we're going to have a nice big old anniversary cake to celebrate this milestone. So we hope that people come out and help us celebrate. We're going to have some of the folks who have worked in our department over the years, and of course Paula Mahan will be there to help to celebrate the occasion with us. But we're really proud of the work that we've done and how our department has grown over the past 30 years. So that's exciting. Thank you. Thank you. And, we always look for a reason to have cake.
We're that way in the library, too.
Yeah.
What other events or programs are you looking forward to for senior resources?
Well, the fall is a very busy time, and that's why I was hoping to touch on some of the upcoming events that are coming up that seniors need to know about. We'll start first, because so much of today's discussion has been on housing, is the Home Energy Assistance Program. That's a critical program, and a lot of seniors already participate in the Home Energy Assistance Program. And what it is a heating assistant grant that folks can get once a year. I don't know the guidelines off the top of my head, as they just went up a little bit, but approximately for a single-person household, if you have monthly income under $2,000, and that would be Social Security, bank interest, pension, and any wages if you're still working, if your income falls under $2,000 a month, then you're eligible for a heating grant. And last year the grants varied from $300 to $700. And that's that's like 2 or 3 National Grid budget payments, is the way I look at it for most seniors that I help. So you have to apply every year. If you received it last year, you'll get an automatic application in the mail, so you don't need to call our office and say, I haven't got my application yet. The program opens November 1st, so it's a little early, but we like folks to apply for HEAP. Even if you're not eligible, at least have us, look at your income and see if there's some other programs that you might be eligible for. Because if you're eligible for HEAP, it opens up the door to be open for a lot of other programs. Like I mentioned briefly at the housing fair, we're going to have weatherization folks there. If you're eligible for HEAP, you're automatically eligible to have your home weatherized through Albany County at no cost. So these are important things for folks to know about. We do put out a lot of publications and information, but sometimes, we don't really pay attention to it till we need it. So, think about the HEAP program. It's really important. And the other very important time of year that this is for our office, and we just started gearing up for it today, is open enrollment for Medicare D. Medicare is, it's a big issue. It's a big program. Prescription drug coverage is one of the highest demand for services that we have that seniors call us looking for. It's complicated, as you know, as doing this health show. People can't begin to understand how Medicare works with the new Medicare D plans, and then there's Epic, and if I have Epic, do I need a Medicare D plan, and do I still have to pay for Medicare B, and is there any financial help in paying for all these premiums? And there's a lot of help out there. Our office, our caseworkers, our New York State health insurance counselors, they're certified to give unbiased information and walk seniors through the maze of healthcare options that are out there. So I always tell people who are on a D plan, this is the time of year that you really need to look at what your policy looked like in 2009, and then also contact your insurance company, and they'll be sending information out to tell them what their plan will look like in 2010. Have the premiums gone up? Have the co-pays gone up? Has there been a reduction in what they're going to provide to you? If this is overwhelming to you, and 9 out of 10 seniors and their adult children or caregivers it is, contact our office, make an appointment to meet with one of our health insurance counselors so that they can give you that unbiased information so you can make an informed choice. So we spend a lot of time on that. Open enrollment is from November 15th to the end of the year. So the important thing that we can also do is to look if there's any financial subsidies to help you pay for that. Now, the insurance companies aren't going to help you with, financial subsidies to help pay for your health insurance costs. So that's why it's really important to, educate yourself and get the information. So those are the two, big programs that we're gearing up for in the fall and in going into the winter months. And of course, as I mentioned, the weatherization program, as we're helping folks with the heating assistance program, we say, gee, we may be able to help you to get your house insulated, or get your storm doors or whatever you might need, so that you can save on your heating costs over the winter. So it's the busiest time of year for our office. In addition to that, we help a lot of folks that maybe wouldn't be able to prepare a Thanksgiving meal or have family to spend Thanksgiving with. We work very closely with the Equinox program to do the home delivered meals for Thanksgiving. If folks think that they want a meal for Thanksgiving, they don't have family to be with, or they just can't cook anymore, contact our office and we'll put you on the list to get a Thanksgiving meal. So that's a big program that we have going on. And then that brings us right into, the holiday season, which is a fun time in our office, because all the clubs are having Christmas parties, and it's an opportunity for folks to get out and to socialize and to have some fun, because it's difficult for seniors today. There's a lot more. They're dealing with a lot more issues. Their Social Security isn't going as far as it once did, and there's a lot of demands on how they're going to spread their limited income. So, utilize the resources of the town, of the Senior Resources Department, to be able to get whatever help that might be out there waiting for you.
Now, I noticed on your website that you had certain things that were like the third Friday, the second Thursday, or things like that. What have we missed out on that you haven't mentioned?
Well, we mentioned the Benefit Assistance Day, which is a very important program. But one program that we do here on the fourth Wednesday of every month, and it's held right here at the library, is our Transition Support Group. And this is a very nice group. It kind of was... It came to be because we always did a caregiver support group, and when folks stopped being a caregiver, whether their spouse or their family member died, or the caregiving role stopped for whatever reason, they still needed support with the changes that were going on in their life. So this is a change group, really. Men come to it, women come to it, adult children come to it, seniors come to it, and it's just to talk about loss and change. It's not necessarily a grief group, but it's about coping and picking up and moving on with your life. We have a nurse that facilitates the group for us, and it's the fourth Wednesday at 1:30. You don't need to make a reservation. You can just come into the library, and the folks at the desk will direct you back to the room. So it's a nice group, and that is an ongoing event, just like the Benefit Assistance Day. Those are the two primary ongoing events that we do in addition to the club activities.
Okay, I think we might have covered everything.
We covered a lot.
Let's just mention again when the housing fair is going to be.
Okay, that's going to be October 22nd at the Crossings Park.
Okay, from
1 to 4
1
p.m.
to 4 p.m. Okay, and let's just talk about how to contact Senior Resources once again.
Of course, you can go on the town's website, and there's a link to our department, www.colonie.org. But I think for seniors, the best thing to do is to call our office directly at 459-5051. Hopefully, you'll never get an answering machine. Our staff answers the phone. They're trained and ready to answer any questions that you might have, whether it's on the clubs or it's on programs or it's on the housing fair or Medicare, whatever it is that your need might be. We should be able to help you on that first phone call. We try to do everything in our office right through our office, because we don't want seniors or anybody to have to make 10 calls to get one phone number. So we're kind of a one-stop place to start for services in the town for seniors.
Okay, any other thing you wanted to mention, or?
No, I just want to thank you for having me on today.
Okay, thanks, Christine. Thanks for watching. We hope to see you next time on Focus on Health.